For most people, triglycerides are a health risk that should be lowered. But what are triglycerides, and why do we need to lower them? Triglycerides are substances containing 3 fatty acid molecules attached to a molecule of glycerol. When you eat, your body converts the food you eat into triglycerides and stores them in the fat cells. Triglycerides also are released into your bloodstream when you digest food and use them when body requires energy. High triglycerides can develop when your body makes too much fat or doesn't use its fat well. When triglycerides in the blood are elevated, the condition is called hypertriglyceridemia. High triglycerides are associated with increased risk of heart disease and diabetes, and can also be associated with increased risk of stroke, peripheral vascular disease, and fatal heart attack. It's essential to have triglycerides measured if you think you're at risk for heart disease or have other risk factors. Talk to your doctor if you have a high level of triglycerides. In the meantime, you can take the below steps to lower your triglycerides naturally. 1. Losing weight. Your body stores triglycerides in fat cells, and when you lose weight, your fat cells shrink. That enables you to keep your weight off. However, if you gain weight, your fat cells grow, so you'll need to keep dropping the weight to keep your triglycerides low. A recent study found that reducing the weight by about 5% decreases blood triglycerides by 40 milligrams per deciliter. 2. Exercise. Having high triglycerides can make you more susceptible to heart disease, so it's essential to keep them as low as possible. Regular aerobic exercises can increase HDL cholesterol in your blood, which can reduce triglycerides. Aerobic exercises include jogging, swimming, cycling, and walking. We recommend at least 30 minutes of exercise every day. Enjoying the video? Then give it a like and share it with your friends to help the channel. 3. Choose the right fats. Our body requires fat to function correctly. Some fats are healthy and some are not. Choosing the right and healthy fats will help reduce triglycerides. Trans and saturated fats such as meat, full-fat dairy products, palm oil, and coconut oil raise triglyceride levels, so try to replace them with healthy fats. Unsaturated fats, especially polyunsaturated fats, on the other hand, reduces your triglycerides levels. Try to include avocados, olive oil, omega-3 fats such as flax seeds, cod liver oil in your diet. Try to replace your steak with tuna or salmon. Also, replace red meat with lean meat, fat-full dairy products with fat-free dairy products. 4. Limit your sugar intake. When you eat sugar, it gets converted into triglycerides in your liver. This is why it is important to limit sugar intake, resulting in more fat in your body. Replacing sugar-sweetened beverages with water can lead to a decrease in triglycerides. Additionally, reducing added sugar in your diet will help lower blood triglyceride levels. 5. Eat the right carbs. Eating the right carbs is always essential for a healthy lifestyle. Consuming simple carbohydrates and refined carbohydrates will increase the fat content. Reduce intake of simple carbohydrates such as sugar and syrups, and refined carbohydrates such as white bread, refined sugar, and juices. Instead, increase intake of complex carbohydrates such as vegetables, beans, and whole grains. Complex carbs also have vitamins, minerals, healthy fats, and fiber. 6. Cut back on alcohol. For some people, drinking even a tiny amount of alcohol can have a significant effect on triglycerides. It's better if you can stop alcohol consumption, as it'll increase your triglycerides. Talk with your doctor regarding the consumption of alcohol. Try out these and let us know in the comments, did you guys try any natural way of reducing triglycerides? If you like the video, give thumbs up and subscribe to the channel.